My name is Dr. Feurerbacher. I'm a family practice doctor here in Maryville, Missouri for the last 19 years, and I'm here today with Dr. Lisa Distefano to talk about the COVID vaccine.
So I'm Lisa Distefano, and I've been here since '99, so 21 plus years, and I'm internal medicine and pediatrics, and I'm also here to talk about the vaccine. We're both vaccinated, so CDC says we can gather without wearing our mask, and we thought it'd be easier to talk to you this way. It's important because we want to develop an immunity throughout the community. So some patients have already had COVID, and they have a passive immunity for, we think, about possibly 3 months, possibly more. But with the vaccine, we're hoping that more people will not allow the virus a chance to get a hold in our community. So the more people that are vaccinated or have immunity, it's favorable to decrease the prevalence of the actual virus.
Well, the virus is pretty harsh what it does to our body. It does a lot of changes internally and stimulating cytokines and inflammation, and so there's some discussion whether we mount a good permanent immune response when we have the virus. And then the second reason is the virus itself is rapidly mutating to many different strains. When it comes to other countries, we've found that people can catch the virus over and over again, and sometimes it can be even more deadly the second time around.
So what we've been seeing starting in other places, but now variants are developing. Another reason to keep the level of virus low within the community is less chance for developing variants, but we're starting to see more variants now in the United States. So far, the vaccine has been effective against the variants, but we're not clear if having had COVID would actually protect you against the new variant, since it's a different form. So we're encouraging vaccine even if you've already had it, in order to be protected against the variant forms. And even if you got through it the first time, which is wonderful, we don't want you to be exposed a second time and perhaps even spread it passively to another person who's more at risk.
Well, death is not our only measure. So if 1% of people die, that's still a lot or too many. However, since both of us have been treating COVID since the beginning, we know from personal experience with our patients that there's a huge morbidity associated with it as well. Many people have permanent lung scarring, breathing problems, lack of smell, lack of taste for months and months, and still has not recovered. So even if you throw out the death rate, it's still a very, very harmful virus that's done a lot of damage.
And it may not be particularly harmful to the person who gets it, but it still can be passed on, whether or not you're severely symptomatic or even mildly symptomatic, to someone else who may not have the same opportunity to fight off the infection like the primary vector did.
So the technology of the vaccine, the RNA technology, has been around for years and has been studied for years. I've been asked why we can't just make an immunity to any other virus like HIV, etc., with using the same technology. And it turns out we just kind of got lucky with this virus in how it's made. It's made with a shell with little spikes sticking off of it. Most viruses do not look like this at all. So in this case, we were able to make an immunity to the spikes on the end of the virus.
The vaccine isn't as new as we perceive. It has started in development over 10 years ago when the initial SARS outbreak occurred in Asia, and then there was a MERS outbreak, which was several years after that. So they've been working on development of this mRNA vaccine for some time. It also, as far as the emergency authorization, it seemed to go through the FDA quickly, but it's simply that they did both phase 2 and phase 3 trials concurrently, which made the rollout much sooner.
Well, from my perspective, seeing and treating patients and talking with people every single day for the last several months about how bad coronavirus has been for them. Granted, for a lot of people, it's been very, very, very mild, and there's just no way for us to predict who has a terrible outcome and who has a bad outcome, and then who has just a very minimal outcome. One thing I've been asked is, well, what about the long-term complications of the virus versus the shot? Well, the shot is just a little tiny piece that we develop an immunity to on the shell, versus the virus itself creates a lot of issues in the body. I fear the virus significantly more than I fear the shot.
And I will say, as far as trust, I mean, I'm fully vaccinated. All my older members of my family are vaccinated, and as soon as they roll it out for general, my children will be vaccinated. I feel like it's important not only to protect them and myself, but I'm in contact with people every single day, and I would not want to spread the virus to anyone else if I can avoid it. I've seen the effects, and I would rather protect as many people as I can, and if that includes myself with getting the shot. I mean, I would take whatever shot they had available as soon as you can, because it doesn't matter. We've seen no significant difference in side effects or patient complaints.
Right. And as a physician, I took the very first shot that was available, and I didn't even know which one it was until I showed up for it, because it didn't really matter to me. Mm-hmm. The data on all of them shows it works very well, so I personally didn't have a preference.
Say that this has been a really hard time on everyone, and that the 2020 was a horrible year. We had shutdowns, we had a lot of losses, not only just in people, but tolls on missed opportunities, missing family, isolation, and our goal is to really get back out to living a very normal life, and that's going to be feasible with high vaccination rates and continuing to wear a mask in public until we're at a better rate, so we can all continue to go out, continue to enjoy our lives and eat out and go shopping and see sports and get back to as normal as we can.
So I would want to encourage everybody to strongly consider getting the vaccine. I agree that it's our quickest way to get out of what we've had to go through and endure over the last year. We at Mosaic Maryville want you to team up with us and help increase the vaccination rate.
And if you have any questions about the vaccine or any concerns, feel free to ask us. That's what we're here for. We'd like to be a resource to help you all make your decision.